Hi, I'm Justin Riley. Today on Wisconsin Doctors, we have a variety of topics to talk about, including cancer care and labor and delivery. We'll be on location at Mile Bluff Medical Center in the beautiful city of Mauston, and we'll be joined by Kathy Behnke, Director of Public Relations. Kathy received her bachelor's degree from UW-Whitewater in communications with an emphasis in public relations and a minor in advertising. She has been at Mile Bluff in the marketing department since 2000. She's originally from Muskego. Also, Dr. Mike Peck, gynecologic surgeon, will join us. Dr. Peck received his degree from the Medical College of Wisconsin in Milwaukee. He did his residency in Phoenix and has been with Mile Bluff Medical Center for 4 months. Amy Eastman is a registered nurse with the birthing center here at Mile Bluff Medical Center. She has been here for 17 years and received her nursing degree at Madison Area Technical College. And Rhonda Larson, who is the Infusion Cancer Care Director, will join us. She received her degree from UW-Madison and is a certified oncology nurse and has been at Mile Bluff Medical Center for 11 years. That's all coming up and more at Wisconsin Doctors right here on CW57. Don't go away. Welcome to Wisconsin Doctors. I'm Justin Riley, and we are so excited to be here on location at Mile Bluff Medical Center in the beautiful town of Mauston. And I am joined by several great guests, and we're going to start with Miss Kathy Behnke, who is the Director of Public Relations. Kathy, thank you for having us here today.
Yeah, thank you for coming. We're really excited about it.
Yeah, this is a great place, and a great town. We had a beautiful drive-in this morning, so we're really happy to be here. Can you just give viewers a brief overview of Mile Bluff Medical Center, what kinds of things you do and the kinds of things you offer?
Right, absolutely. The Mile Bluff organization actually dates back to 1883. We had Dr. J.S. Hess Sr. who started the organization just with a medical practice here in Mauston. And since then we've grown. We still have a medical practice in Mauston, but we've also expanded to have different medical centers out in 4 different outlying areas and really bringing that care to the region. We've got 2 nursing homes that we have here and a retirement apartment complex for senior citizens, and we also have here right in the hospital, we've got an acute care setting where we have inpatient hospital patients. We have a surgery wing that does outpatient surgical services, and then just a wide variety of diagnostic and treatment outpatient services, laboratory, x-ray, physical therapy. So we've really grown since 1883.
Yes, it sounds like it. It sounds like you've got quite a good thing going on here. And then Mike, you had a question.
Well, I've only been here for 6 months, so I know the growth I've seen since I've been here, but what's been going on the past few years?
Well, I'd say everyone up on this panel definitely represents some sort of growth in this organization. One of the things that has been added recently has been our sleep medicine. We've only had that for a few years, but we have 2 board-certified sleep medicine physicians, and we have a beautiful sleep center. And so that's something that's newer to our organization, and pediatrics as well is something that's been added. In the past years, some of the expansions we've had have really been the infusion and cancer services, and our rehabilitation department. We have physical therapy in a number of locations now where we have taken that out to a few different communities. Just orthopedics has grown. We've been able to add a lot of total knee replacements, hip replacements, really just continuing that growth. So
awesome.
It's been a lot. That's our healthcare evolving for life. We kind of look at it that way.
I like that, healthcare evolving for life, because you're always continuing to grow.
Absolutely.
That's awesome. Amy, you had a question.
Yeah, what do you feel really sets Mile Bluff apart from some of the other facilities in the area?
I think a lot of what we've been talking about, just the growth aspect of it, but not just because we're growing, but because of the philosophy behind why we've been able to grow. And it's not just looking to add new things, but it's been the idea of looking to the future of what our patients are going to need, because there's no way we'd be around since 1883 if we weren't doing that. So I think that definitely sets us apart. We're able to bring a lot of services to our community here and to be able to grow with them. And I definitely think that sets us apart. And we are an independent organization. So what I mean by that is we don't have an affiliation with one specific larger healthcare organization, and that really allows us to be able to improve the access that our patients have to care. We're able to bring some of those specialists to see our patients right here, and then when they do have to travel for care, we're able to partner with a lot of different people and give our patients options. So I really think that is also something that sets us apart.
Right. So you're not restricted to sending your patients to one place or another.
Right, exactly.
Yeah, absolutely. And then Rhonda, you had a question.
Yeah, Kathy, what would be one thing you'd want viewers to know about Mile Bluff?
There's a lot I could say, for sure, but I think that, for us who work here, we get to see just the awesome stuff that happens every day, and we see lives change, and we see this healing happen. And I would just use the simple sentence of Mile Bluff as where it happens, because there's so much that goes with that. And it's where cancer is defeated. It's where hearing is restored. It's where healing begins. It's where families are expanded. And there's so much in that small sentence that I really think says so much about who we are.
Absolutely. I think Mile Bluff is where it's at. That should be your tagline, man. Because that's what it sounds like to me here.
Yeah.
So, well, Kathy Behnke, thank you so much for the info, and it was great talking with you. So,
thank you.
Don't go away. When we come back, we'll be talking with Mike Peck, who's sitting to my right here, and we will be right back with more Wisconsin Doctors. Stay tuned. Welcome back to Wisconsin Doctors. We are on location at Mile Bluff Medical Center in the beautiful town of Mauston. And next we'll be talking with Dr. Mike Peck, who is a gynecological surgeon here at Mile Bluff. Mike, welcome to the program.
Thank you. Thank you.
So good to have you here.
Justin, thrilled to be here.
I love your tie. That is a really snazzy tie.
You know,
We're going to have to get a close-up of that a little bit later, I think. So.
I enjoy wearing ties. If it's going to wear something, it's got to be fun, though.
Yeah, absolutely, absolutely. You kind of outdid me there. Tell us about some of the gynecological services that are available at Mile Bluff Medical Center right now.
Well, we have our family practice doctors do obstetrical services, do deliveries here. Mm-hmm. We've got an anesthesia department, provides 24/7 coverage for the emergency room, for the operating room, and for labor and delivery, for labor epidurals. More towards the gynecologic, we have a women's health physical therapy team who sometimes surgery or medicine's not the best answer, and something simple like women's health physical therapy can address the problem with no side effects and a long-lasting thing. I tell patients you have a bad shoulder, you go to the physical therapist.
Right.
Nothing different. And then our operating room, our crew, our staff is just phenomenal. And the people are great, but also there's a motivation to make sure that we have up-to-date equipment so the surgeons can practice medicine at a quality of care and a standard of care that's current. And so that's been the most enjoyable part for me.
Absolutely. Awesome. And Kathy, you had a question.
Yeah, speaking of current, you hear a lot of things with robots being used. Do you have any experience in the surgery world with robots?
I have actually been trained and credentialed on robot, and it's a fun toy to play with. Okay, and that's about all I've gotten out of it. Surgeries with the robot took longer, and it didn't add anything that I was not able to do without the robot with conventional. Robot is not that you plug it in, the robot does the work.
You walk away and have a cup of coffee or something.
You know, think of the arm on the shuttle that would go in the bay door.
Right.
So the surgeons are controlling it with their hands, and it's just the instruments that are different. But robots cost $1.75 million a piece. There's additional costs for the instruments that you have to attach to it, which you have to rebuy. And studies have shown that to do a laparoscopic hysterectomy is $2,000 less conventionally. If you use a robot, it costs $2,000 more without any better outcome, with the longer operative time. So there are some procedures that robots, you need it for, and a lot of oncologic procedures, for GYN oncology or for prostatectomies, but for routine gynecologic, robot just adds cost. And that's been proven in multiple studies. But it's a fun toy.
We like to have one of those.
Everyone should
see if we
have
can
one.
find one on eBay, folks. That'd be great. Amy, you had a question.
Yeah, more and more when you're watching TV, you see these lawyer ads about the mesh lawsuits. Can you tell us what these are about?
Mesh is, you think of a gauze, and that's kind of what mesh is, but it's more of a plastic. And for years, general surgeons have addressed hernias with mesh, because they know if we don't use mesh, they're going to recur. Well, with when the bladder drops out, or things poop out, or the uterus is dropping down, it's a hernia. It's a weakness in the body wall. And there's a high rate of recurrence when we do the traditional way. So we thought if it works for general surgery, it will work for gynecology. And gynecologists started putting this mesh in. Well, the vagina is a different organ than the abdominal wall. And then you started seeing problems with erosion of the mesh. It's not that it's a bad procedure, it's in its innovation. Not everyone needs it. And so now we still can use mesh, but you have to select the right patient. You have to counsel correctly. And just one big thing is that there's a procedure that we do that has just a small piece of mesh, not something about like this, that just goes under the neck of the bladder. And the FDA has got no problem with that. And so patients come in, and a lot of gynecologists do this procedure. So you have to separate out that little piece that the FDA said, no, this is a great procedure, with the other procedures.
Yeah, absolutely. And Rhonda, you had a question.
I think that there are similar ads about morcellation.
Yeah, yes, same. Morcellation it allows you to take something big out of little small puncture sites. And now they found out that there's a 1 in 200 to 300 chance of doing that, missing a cancer, and then having the cancer kind of seed into the abdomen. Obviously that's not good, but on the other hand, you're going to subject 200 to 300 people more to having a incision, which has more morbidity and actually more mortality. So once again, it comes down to patient counseling and patient selection.
Yeah, so always check with your physician, in other words. It always comes back to that.
And second opinions never hurt.
Yeah, absolutely. Well, Dr. Mike Peck, thank you so much for joining us today. Don't go away. We'll be right back with more Wisconsin Doctors, and we'll be talking with Amy Eastman. It's Wisconsin Doctors on CW57. Welcome back to Wisconsin Doctors. We're on location here at Mile Bluff Medical Center in the beautiful town of Mauston. And next we'll be talking with Amy Eastman, who's a registered nurse with the birth center here at Mile Bluff. Amy, thank you so much for having us here today.
Thank you.
And welcome to Wisconsin Doctors.
Thank you for having us.
Yeah, it's great to have you. So, you know, we're talking about expecting your first child, second child, third child, doesn't matter, or if you've already had children. A lot of parents are trying to educate themselves and find different ways of either preparing for their first child that is not here yet, or be better parents for their child that is here. What are some of the educational opportunities that you have here, and who would you recommend take advantage of those?
Well, we have our OB nurses that are in the birth center, the RNs that actually work and take care of the patients, teach our classes. We offer educational classes in different locations, Lake Dalton, Necedah, Friendship, and Mauston right here. We know that everybody has a busy schedule, so we offer a 3-week program where they come once a week and are instructed at night, and then we also offer a full-day course on Saturdays. And we encourage parents, caregivers, significant others, support people, anybody that's going to be involved in the labor and delivery process and the care of the baby. The classes cover what to expect, signs and symptoms to look for before you go into labor, the pain management for the labor itself.
Sure.
postpartum care of the mom, newborn care, and preparing you for discharge.
Absolutely. So you got a lot of great things to offer, and then it also seems like it's very convenient times. You do evening times for people to come in, and then you have an all-day thing as well.
Yeah.
So very good.
And we also encourage to have car seats inspected before the parents actually have the baby, and public health departments in their area should be able to do that for free.
Absolutely. Kathy, you had a question.
Yeah, there's the newer practice of skin-to-skin contact between mother and baby immediately when baby's born. Can you talk a little bit about what the benefits are for mother and baby?
Sure. I think this is a great change in the birth center. I've been a nurse for 17 years, and this has just started in the last probably 3 years. So immediately after baby's born, if mom is stable and baby's stable, we put the baby on the mom's bare chest, and this encourages bonding, keeps the baby warm, and keeps the heart rate and respiration stable. It's also great for breastfeeding if they decide to breastfeed. And there's been research that shows that there is a reduction in postpartum depression if that's done. We also, even if you have a C-section, we try to do that after the C-section if it's appropriate, and we even have dads that do skin-to-skin.
Wonderful. Can't leave dad out.
No.
You got to have dad in
No.
there. So.
My sister-in-law, she had her 4th child here. The other 3 were in the Milwaukee area, and she said that was just amazing, and it really made a difference for her. She really appreciated that part of the experience.
And it's a change for us too, because we're so used to doing certain things right after delivery. You know, babies get shots, babies get weighed, and so we have to delay that, but it's worth it for the parents.
Yeah, it is definitely worth it. And Mike, you had a question.
Well, Amy, most parents are worried about their baby not sleeping when they go home. Can you discuss the new guidelines and recommendations for safe sleep for babies?
It's changed and off and on through the years, and if you are, usually grandparents, babies always slept on the belly, so it's a new change for them too. But for safe sleep, we educate parents, anybody that's going to be caring for the baby, to lay baby on its back to sleep. Back to sleep is the in research shows that this prevents SIDS, and sudden infant death syndrome is the leading cause of death in babies from 1 month to 1 year. So in the environment that the baby sleeps in, it should have a firm mattress in the crib and no stuffed toys or blankets. They should sleep in an area next to where the parents sleep, but not with the parents. You should never sleep with your baby. No adults should sleep in a chair, couch, or bed with babies.
Right, absolutely. There's a lot of safety issues there, I would imagine. So, Rhonda, you had a question.
Yeah, Amy, do you have any suggestions to help prepare patients for coming into OB?
Sure, definitely take classes. We encourage that. It's just, I think knowledge is power, and if you can take those classes and be prepared, it just helps a lot more to deal with what's to come. You can get pre-registered during your classes. And just bring anything that would make you comfortable. We do offer some aromatherapy and other comfort interventions, but anything that would make you comfortable. Your camera, of course, and baby stuff. And we offer baby books, but you can bring your own if you'd like.
Absolutely. Amy Eastman, thank you so much for the information today.
Thank you.
It was nice talking with you. Don't go away. There's one more segment of Wisconsin Doctors coming right up. We'll be talking with Rhonda Larson. It's Wisconsin Doctors on CW 57. Welcome back to Wisconsin Doctors. We are on location at Mile Bluff Medical Center in the beautiful town of Mauston. And last but not least, we're going to be talking with Rhonda Larson, who is the Infusion and Cancer Care Director here at Mile Bluff. Welcome to the program.
Thank you, thank you.
Yeah, it's good to be here today. So, infusion services, this is a term that I'm not really familiar with. What are some things that you would like the public to know, specifically somebody like me who doesn't know anything about it? Can you tell us a little bit more about infusion services?
Well, you're really seeing more and more hospitals going to infusion centers. Insurances dictate that a lot of things are done as an outpatient, so infusion services are important because patients can come in and get quick infusions or even longer infusions as an outpatient instead of staying in the hospital. So we provide a lot of different services, anything IV related or injection related, those types of things are done in our department.
And that all has to do with cancer care then, is that?
We actually work primarily with cancer patients, but we do work with other patients that have other disorders or diseases that require infusions as well.
Can you just expand on that a little bit more and give maybe some of the specifics services that you do provide?
Sure. In cancer care, we actually started our department about 7 years ago as a full-time department. And so we provide chemotherapy services to the public, which is really great because it's something they can get close to home. They don't have to travel. We also provide infusions for patients with things like rheumatoid arthritis or ulcerative colitis, people with Crohn's disease, things like that, or multiple sclerosis. There are lots of treatments out there that they can use that help them in their day-to-day life. We also do blood transfusions or products, injections of different sorts that patients prefer not to do themselves. They can come in and our department would take care of that for them.
Absolutely. And Mike, you had a question.
Yeah, Rhonda, when I have patients and you tell them they have diagnosed with cancer, they're almost more apprehensive of the word chemotherapy than they are of the word cancer itself.
I think it's a really scary word to associate with a patient. So when they come in, the biggest thing that we want to do is make them feel comfortable. We want them to know that chemotherapy is much different than it was 20 or 30 years ago, and we're able to help them through their side effects and symptoms much more than they were in the past. So we work as a team. We work with the oncologists and all of the nursing staff to try and help make this a better experience.
Yeah, it's a tough experience for anybody to go through, but if they can have that support and have it be just a little bit easier for them, that's always nice. So yeah, absolutely. Amy, you had a question.
What other support or help is available in our area for cancer treatment, related to cancer treatment?
Our department works really closely with the American Cancer Society with the Look Good, Feel Better program, and that's a program where women that are losing their hair or eyebrows or eyelashes need to feel a little bit better about themselves. So they come to this program and a cosmetologist will help and teach them what to do, how to put makeup on, how to work with scarves or wigs and things like that. That's been a super program for a lot of our patients. But other things that we do, financial assistance seems to be one of the biggest hurdles that our patients deal with. And so we work a lot with helping find them financial resources to help pay for bills or pay for treatments and things like that, because that's also a big struggle for them. Yes,
absolutely. And you know, you mentioned the word team a couple of times in some of your answers here and some of your descriptions. And why is, you know, you hear so many more places kind of going with that word team. Why is the team specialized approach so important to the care of your patients here?
With oncology patients, primarily, you'll see that they have a number of different side effects and symptoms to work with. So there are dietitians that can help with certain side effects. There are physical therapists that can help with some. We use the audiology department that works with people that have hearing loss due to different medications that can cause that. So it's a wide variety of people that work together. Our oncologists are super and work really closely with our patients, even though they're not here on a daily basis. And the primary providers are crucial. If we don't have that, it's very difficult for us to work as a team. So we really pride ourselves, I think, on that team approach and making sure not only the patient, but the families are taken care of too.
Yes, yes. Everybody works together, everybody gets taken care of. Mm-hmm. Rhonda Larson, thank you so much for the information today. We appreciate that.
Thank you.
And I'd also like to thank our other guests, Kathy Behnke, Director of Public Relations, Dr. Mike Peck, and Amy Eastman. We've been on location at Mile Bluff Medical Center. From all of us here at CW57 and Wisconsin Doctors, we invite you to live longer, live better. We'll see you next time.